Today, I'm going to explain why your ACL does not like dynamic knee valgus. And Josh Emmett, UFC fighter who recently injured his knee at Apex 3, is going to help me to explain why.
Ladies and gentlemen, can I please have your attention?
Hey everybody, Dr. Chris, orthopedic surgeon and sports medicine physician. Welcome to my channel where I explain orthopedic injuries and sports medicine in a way that's easy to understand for everybody. If you're interested in sports injuries, how they happen, and how they will affect your favorite athletes, then this is the channel for you. Today I'm talking about UFC fighter Josh Emmett and the injury that he sustained on June 20th of 2020 at the UFC Las Vegas 3 event. At this event, Emmett was fighting against Shane Burgos in a featherweight match. This fight was anticipated to be a barn burner, as both of these fighters are heavy-handed strikers who are swinging a bag of hammers whenever they throw a punch. Emmett injured himself early in the match, but he continued on through all 3 rounds of the fight to secure the decision for the win. Given the injury that he had suffered and the time at which he suffered it, it is amazing that he was able to complete the match without more difficulty. If you look at the video from the fight, you can see that he injures himself within the first few seconds of the first round. As Josh is changing direction while moving to his left, we can see that he lands on his left leg at an awkward angle. Although it was reported that he hyperextended his left knee, the slow motion replay shows that his leg was in a bent position when he injured his knee. This position is known as a dynamic valgus, and it is a bad thing. Dynamic valgus refers to the position where the knee is bent during a change of direction, while the knee is located inside the planted foot. Usually, the center of gravity, the point where the majority of the person's weight is located, is positioned behind and inside of the foot and the knee as well. You can see that Josh initially grabs his knee momentarily at the time of injury, but looking at the prospect of being punched repeatedly in the face, he quickly continues on like a trooper. Despite this difficulty, Emmett is able to finish the fight and go on to an eventual decision even after receiving several leg kicks from Burgos on his injured leg. Dynamic valgus is bad for your knee because it puts an excessive amount of force on the ligaments of your knee, particularly the anterior cruciate ligament. In the position of dynamic valgus, the anterior cruciate ligament is stretched to its maximal length. Add a little rotation to the mix as you're attempting to change direction, and the ACL can no longer withstand the forces. And now you have an ACL rupture.
Okay, yeah, that makes sense.
Upon seeing this injury mechanism while watching the fight, I was immediately concerned that Emmett may have injured his anterior cruciate ligament. After the fight, Emmett could be seen limping out of the ring, and it was apparent that he was having great difficulty. 2 days following his injury, Emmett posted his diagnoses on social media. His Twitter post revealed that he had injured his anterior cruciate ligament, or ACL, and his medial collateral ligament, or MCL, in addition to rupturing a Baker cyst behind his knee. He also suffered an impaction fracture on his lateral femoral condyle and a kissing chondral injury, or in other words, a hole in the cartilage on his lateral tibial plateau. Now, this sounds like a lot of stuff that is wrong, but to be honest, this is part of the normal constellation of injuries that we see with this injury mechanism. And while this is not a great thing, it could have been much, much worse. All these injuries mean is that Josh injured 2 of the 4 main ligaments of the knee, one completely, the ACL, and the other partially, the MCL. While injuring these ligaments, his knee was bent into a valgus position. The end of his femur was dented on the outside portion, and the force of this collision was so great that some of the cartilage on the tibia was damaged as well. At least he did not damage either of the meniscal shock absorbers of the knee. Normally, someone with these injuries would experience difficulty with jumping, pivoting, and direction change. Josh stated that he had experienced difficulty with lateral movement during the fight, and he was forced to stand and trade blows, much to his disappointment. In the end, it didn't affect the outcome as he secured the victory regardless. Emmett will face an extended layoff as he undergoes surgery for the reconstruction of his anterior cruciate ligament. Likely, the MCL and the femoral condyle impaction injury will not require surgical management. The cartilage injury on the lateral tibial plateau is also unlikely to require surgical treatment unless it is significantly large in diameter and full thickness and depth. For more information on ACL ligament tears and how they are reconstructed, check out my video on how not to tear your ACL or my video on DeMarcus Cousins' ACL tear. While the typical recovery time for the average person is between 10 to 12 months, Emmett has already announced that he plans to beat the anticipated timeline. He hopes to be back fighting in only 5 to 7 months. Although this may be technically possible, it isn't really the doctor recommended option. Emmett says that his motivation, dedication, and discipline will be the deciding factors. Only time will tell. Now, let's look at my favorite comments from the previous video. If you want to be part of the team that helps with the preparation of videos and the selection of topics, you can support what I do by joining me on my Patreon page, where you will be able to access additional content and be able to interact with me more closely. If you enjoy podcasts and you haven't already, be sure to subscribe to my new podcast channel. The link will be down in the description. And if you're looking for exercises and workouts, or you want more information on injury prevention, be sure to check us out on our sister channel here on YouTube, Human 2.0. Thanks for watching, and as always, that's been a word from Dr. Chris, not your everyday ortho.